Visible. I'm a registered respiratory therapist. I am a certified respiratory educator. I am a registered polysomnography technologist. I hold a certification in clinical sleep health, and I also hold a certification in clinical hypnotherapy. Thank you for coming to this presentation today. This is reducing burnout stress management techniques for RTs. So, objectives: burnout and the unique influence of healthcare in its development, and understanding the integrative approach of mindset and breathwork on burnout and anxiety. Finally, applications of mindset and breathwork in burnout and anxiety management, and the mindfulness and mind-body connection and how it applies to both. So, globally, the estimate of burnout among public health workforce, this was a beautiful systematic review that was done just this past year by Nagarajan and company. And what they did is they looked at a fair sample size, almost 250,000 people, 8 studies. The pooled proportion burnout was 39%. This was a high heterogeneity in the study, which was very helpful for understanding how significant this is. And the other thing that was important in this was that the pool proportion of the studies that there was during the COVID-19 pandemic was 42%, and the studies during the non-pandemic period was 35%. So a good proportion pre and post pandemic. So what was interesting about the study is they found that more than a third of public health workers suffer from burnout, that 39%. And it adversely affects individuals' mental and physical health. So burnout among the public health workforce requires attention to improve the well-being of this group, the socio-demographic characteristics, and type of work responsibilities. They have to design and implement more workplace interventions to cope with burnout and increase well-being. So what is burnout? So burnout in general, it's a work-related stress syndrome. It just results from chronic exposure to stress. So think about your battery. So you have a certain amount of resistance, tolerance, energy that you have to expend. Now, if you are exposed to chronic stress, you're going to wear down that battery. So what happens is you have this emotional exhaustion, which leads to a depersonalization. You find yourself a little bit more sort of feeling a little bit distanced from emotions, distanced from people, distanced from everything. And it's basically a progression that starts off as some feelings of frustration and anxiousness, and then progresses into disorders if it's allowed to go unchecked. In healthcare, this is magnified by a workplace that is culturally and economically inclined to produce stressful conditions. So historically, and this is what we saw in the pandemic, was that economically we are seriously underfunded in healthcare. And so that lends to the typical stress level that you would anticipate with your job. And the type of stress is key here, and we'll go into a little bit. So the unique demands of working in healthcare. So this is where the stress piece comes in. And we understand as healthcare providers that we are going to be exposed to typical types of stress when it comes to patient care. And especially as respiratory therapists, we can be in all different kinds of scenarios. We can be in emerge, we can be in ICU, we can be on wards, we can be in the community, all different sort of scenarios that you'll find us. And the stress that's related to all of those, it's interesting that we have this expected stress in these particular situations. And it's that's not the type of stress that typically leads to a type of burnout. What leads to burnout is this stress where people find themselves doing tasks that it's not patient care. So we're talking about charting and admin work and paperwork. That's all the things that are bogged down. So I don't know about you listening to this webinar, but my personal experience as a respiratory therapist in the community is I see a client or a patient, depending on the setting, I'll see them for maybe an hour. And then there's about 2 hours of admin work that goes with that between referrals and paperwork and charting. And so what we find becomes a little bit taxing is that you're bogged down with this paperwork when you really would like to just be following up with your patients. The other thing too is that, of course, this type of care, it's adrenaline and cortisol filled. So as human beings, we're meant to only be in a fight flight response 5% of our time. If you're working in a hospital situation, and depending on the day, depending on the time of year, cold and flu season and such, it can be a nonstop running from code to code or what have you. In the community, it boils down to running from palliative to palliative situation and helping people stay in their homes and mitigate hospital admissions. So those are adrenaline, cortisol filled, and those days are the ones where it's a bit much on the system and that we're not meant to sustain that. The other one is that this is a workforce of that understands how important dedication is. You have to be dedicated to be wanting to do this type of work, but it kind of goes a little above and beyond, and that perfection, because if the thought is if you're not as good as you need to be, then somebody dies or is hurt at least. So fatigue is seen as somewhat a badge of honor because you are dedicated and you are subscribing to that excellence. The other one too is that we are in this environment of artificial light and chaotic activity. So it really throws off our circadian rhythms, and we find issues with sleep. And we have all kinds of issues with metabolic disturbances because of lack of exposure to natural light. And the whole package just becomes, a little bit of a stress challenge. So when we look at burnout, we look at specifically a 5-stage model, and this is developed by a psychologist by the name of Herbert Freudenberger. And he was an American psychologist that looked at burnout in particular, and he developed the term burnout. And what he noticed was that, we can start off in a position, maybe you're a new kid on the block, the new RRT in a hospital, and you've got this honeymoon stage and you're enthusiastic and you see all these, things that can be challenging, but it's not that big of a deal because you understand that you're going to make some change. Stage 2 is the onset of stress. So you're feeling a little bit kind of stuck here and there where, things are starting to kind of hold you back. You're noticing the weight of the way the system runs and that sort of thing. And then, a little bit more time and you've got this chronic stress. And this is this frustration that really sets in. By the time you hit stage 4, there's burnout. And it's just a general sense of apathy that, the system's not going to change. And it's this massive thing. And that you're just kind of stuck in this little bit of a hamster wheel. Stage 5 is habitual burnout, and this is where we definitely need to look at intervention. When you look at the symptoms in stages 2 and 3, we see that they're a result of uncontrolled stress, and they're more easily recoverable. So they're just things like anxiety, some irritability, maybe some frustration, and then some physical characteristics such as headaches and frequent illness. Allowed to continue, stage 4 and 5, we start to see disorders, actual disorders such as chronic tiredness, depression, anxiety disorders, and physical disease. So how do we treat this? When we look at treatment for stages 1 and 2, we're looking at basic lifestyle changes, perception changes, stress management techniques, looking at your supports, and because these are somewhat uncomfortable symptoms and can affect your quality of life. However, they're not significantly impacting your health and your ability to perform your job. Of course, the changes in work environment are key as well. And the U.S. Surgeon General made some fantastic recommendations post-COVID, and basically quoted, spoke specifically about burnout in general, and how healthcare workers are at an all-time high. And during COVID, the numbers skyrocketed, of course. And then immediately post, just saying that, we needed to look at how we structure the workplace with healthcare. We need to look at, how we treat people as individuals. Are we decompressing after we have, we deal through traumas? Are we allowing schedule shifts and changes to accommodate people with, these early symptoms of stress, such as, and burnout? And basically, you look at some of the stress management techniques. I mean, these are all over the place these days. 5-10 years ago, we didn't see these things, such as meditation and breath work. These are for, sort of sideline specific groups, but we're really seeing these in mainstream now, because stress management techniques are really coming to the forefront, and in part due to these wonderful recommendations by people in positions of power, such as the U.S. Surgeon General. When we look at stages 4 and 5, the treatment becomes a little bit more structured and a little bit more into the psychotherapy piece. So, and this is because we're moving into the disorders category and the disease category. So we're looking at possibly pharmaceuticals, some CBT. When I did some of the research for this study, none of the therapies other than cognitive behavioral therapy had any sort of clinical weight behind them in terms of effectiveness in treating burnout. So cognitive behavioral therapy is what I leaned on for this particular study, but there definitely, and a lot of the literature said, there needs to be a lot more attention paid to what we are, how we are treating, and what we are contemplating using for treating burnout. When you look at CBT and pharmaceuticals, it's really typical, especially in the sleep world, to pair a cognitive behavioral therapy or a psychotherapy of some kind with a pharmaceutical. And the reason for is that the pharmaceutical tends to, stabilize the client a little bit in terms of anxiousness or depression, and while they start to learn some of the techniques with the CBT. And the interesting thing is CBT has so many different types of techniques. It's a massive umbrella. But most commonly we see CBT involving breath work and meditation and forms of visualization. So anxiety, and I picked anxiety as the one sort of symptom and the disorder that came into play here, because anxiety itself is a very broad and very common word that you'll hear today, and people talking about anxiousness or anxiety or my anxiety. Again, this isn't something we heard as much, even as far as 5-10 years ago. So when you think about anxiety, what is it? And it's, when someone says they have anxiety, what they're talking about is it's an emotion, and it's a future-oriented emotion. It really is to do with basically excessive worrying, thoughts that kind of, people talk about that hamster wheel that goes around and around and around in their head. And they also will notice physical changes with this, like increased blood pressure, because if you have those same worrying thoughts carrying on in the head, it's going to tell the body to be ready for a fight or a flight. On the other hand, we have a very useful emotion, which is fear. And fear is present oriented. So think of it as, if, you were being chased by a bear, you have to be present in that moment, really understanding what's happening around you in this moment. You can't be worrying about the future, and you can't be thinking about the past. You have to be present to be able to save yourself. And this is what fear does. It keeps you present oriented, and it's meant to be a short-lived response to a clearly identifiable and specific threat. And this is very different from anxiety, which is long acting, and it's a broadly focused on a diffuse threat. So it's really hard to pinpoint what is really worrying somebody. If you ask them, they can just say, oh, they just have all these thoughts going on in their head, and they don't have one specific thing that they're worried about. So if you think about anxiety, I mean, everybody has faced anxiety. If you're a human being, you faced anxiety. So if you think about it for a moment, how do you experience anxiety? Everyone is a little bit different. So what happens first for you? Do you notice that you have thoughts that won't stop in your head? Do you notice that you might have a tight chest, or quick breathing, or a tight muscles, or clenched jaw, or something else? Do you notice a combination of factors? And when you think about all of that, when we talk about relief, we talk about what you would prefer to experience instead. So what would that be for you? Just thinking a moment what that might be for you. Anxiety disorders are basically this progression. So if we get to the end of burnout, we don't deal with this anxiety in the first two stages. We end up in anxiety disorders, which are panic disorders, phobias, PTSD, OCD, obsessive compulsive disorder, generalized anxiety disorder. And this is really interesting fact that I've found is that in COPD, we see generalized anxiety disorder, panic disorders, and phobias are most prevalent. And these are the clients that we're seeing as respiratory therapists. And so really being aware of what type of anxiety disorders are affecting these people, so that when you are working with them, that you can understand a little bit about what is happening for them and how you might be helping them through things such as breathing techniques or otherwise. So I just wanted to give you an idea about the prevalency of anxiety here. And this was a really interesting piece that was put out by the U.S. Census Bureau. They came together with the National Center for Health Statistics, and they put together this household pulse survey. And so basically what they did is they looked at groupings, and their 10-year groupings of people. And so they found that the people in the youngest group from 18 to 29 had the highest symptoms of anxiety. And you'll notice that specifically as you go up 10 years, you go down in anxiety incidents. Something happened here towards the end of 2023 as well. And I'm not sure what that might have been. I'm not sure if that was a statistical error or if there was something that happened just in general in the world. But there was a drop in the anxiety levels, and they seem to have in 2024 really settled out. You can see, of course, post-COVID, they're a little bit all over the place, but in general, everyone responded pretty much the same, except for the 80 years and above. Now, those folks, I think in times, there's lots of things different going on in around the world. When you're getting into the 80-year age group, there's a lot of things that may affect your mortality. So those folks can have a little bit of variability, I'm sure, with time. If you look at just in general, the national estimate, you can see that we were close to about 27% here. And then when we hit about 2024, January 2024, we dropped to about 18-19%. So, and it stayed pretty consistent since then. So 2024 has been somewhat of a consistent year in terms of the anxiety that people report to experience. And of course, the significant downshift, again, what caused that? I'm not sure. I couldn't find anything in their data or their history to say what might have caused this. So when you look at factors that are associated with increased anxiety, what are we looking at? We're looking at ethnicity, we're looking at gender, looking at gender identity, and all of these factors too, you can see when they look at these pulse surveys, they look at all these things too, and you can actually go onto the site, this National Center for Health Statistics, and you can pick in this select group. Instead of looking at national estimate, you can look at these things such as ethnicity, gender identity, and sexual orientation, where people live, education, socioeconomic status, age, and disability, and how all those things also affect anxiety. So how we self-care. So this is a really interesting thing. When we look at anxiety in general, a lot of people, when they are having anxious thoughts, the tendency is to want to resolve the problem that is circulating around in the head. However, one of the key things that we look at for offering for people when they have these anxiety symptoms or stress symptoms is we talk about self-care. Now, self-care is a massive subject. So, it can be so many things. This picture here was taken on Long Beach on Vancouver Island, where I live. One of the most beautiful places in the world. People come here to surf from all over the world. It's an incredible place. So, for this gentleman here that was walking on the beach this day, that's his self-care. Maybe your self-care is cuddling up with your cat, or maybe it's talking to a friend or something else. So just thinking for a moment, what does it mean to self-care for you, and how do you find yourself doing it right now? Do you work it into your day? Do you find a few moments here and there, or do you try and find a moment, several moments at the end of the day, or maybe at the end of the week? Maybe Friday's your day. And how's that working for you? What happens when you take the time? Is the structure working for you? What kind of thoughts do you notice come up for you when you self-care? How different are they from anxiety? And notice too how calm the body is, or just how different are you finding that you're more clear? And in general, how balanced is your life? So how are you balancing self-care and some anxiousness? And that brings me to the concept of mindset. So when I look at definitions for the cognitive pieces, I always look at the American Psychological Association, or the APA. And their definition is interesting. It's a state of mind that influences how people think about and then enact their goal-directed activities in ways that may systematically promote or interfere with optimal function. So in other words, a mindset can be both positive or negative from your perspective. From a hypnotherapy perspective, we see two main things that shape mindset. So the first one is CNS tone, or central nervous system tone, and the second one is the subconscious mind. So central nervous system is separated into sympathetic and parasympathetic nervous systems. Of course, most people are familiar with the sympathetic tone. It's your fight, flight, and sometimes freeze mode. And the parasympathetic tone is your rest and digest mode. So the interesting thing is we use both of these systems at all times, but depending on the task at hand, you will have one that is more predominant than the other. So in other words, the thoughts that you have, the intentions that you have, and the brain function all determine which is predominant. So if you look at someone who has PTSD, there's a little bit of rewiring that's happening. They're more prone to using sympathetic tones. If you look at a monk, he's practiced at calm tones. He's practiced at parasympathetic. So he's going to be more likely to be in that calm state of mind as a general default. So awareness of what's happening in the moment around you drives the best tone for the best response. So you're matching what you need. So no matter what your tendency is, if you have awareness in the moment about what is happening around you, you can more appropriately react to what is required in the moment. So this goes back to the nervous system. When you look at the nervous system, most people think, oh, it's the brain and the spinal cord. But there's been lots of different research that's happened down to this interesting one done by McCratty back in 2004. And what they did is they looked at the electrophysiological evidence of intuition. So it gets a little woo here, so just hold on for a moment. But basically what they did is that they looked at the intuitive perception of the heart and the brain. And what they found is when they tested people, when they exposed people to stimulus, they found that they had a heart response earlier than a brain response. So in other words, the heart could pick up what was happening in the environment before the brain did. So where they go back to it here is that there are these 40,000 neurons working independent of the brain in the heart. So they know that these neurons collect information, and they're neurons just like the neurons that exist in the brain, but they are working independently of the brain. Now, the interesting part then here is that these neurons are sending information back to the brain. And what we notice here is that the heart is controlling the brain more than the brain controls the heart, in the way that we react first with heart response before we react with a brain response. It's quicker. And why exactly? We don't know 100% why or how. We just know that it does. Now, second, we've got the gut brain. So the gut brain, this is an interesting one. The gut brain, is a collection of 500 million neurons, again, that work independent of the brain, but these exist in the gut. Now, they control the activity of the brain with serotonin. We make 95% of the body's serotonin, or the happy hormone, in the gut. Now, when your gut is off, you'll notice that people who suffer from depression or suffer from mood disorders, or just in general, when they don't feel well, they have more of a depressive or a flatter attitude. And this may have something to do with the serotonin production that's probably not as optimal when the gut isn't functioning as it's normally used to. The interesting piece too here is that the vagus nerve that extends down into the gut, the signal from the vagus nerve mostly moves one way, from the gut to the brain, not from the brain to the gut like we originally thought. So when you have a calm gut, when you have a calm, gut producing serotonin and relaxed and resting and digesting, it's sending those same signals through the vagus nerve directly to the brain to say everything's groovy, it's all good. And finally, we have the brain. So we have 1 billion neurons that basically drive body function and the conscious mind. And again, it connects from the heart and the gut to the brain with the vagus nerve. So think of it as its little highway that moves back and forth between the three. And interesting here too is most of the time we think that the brain has this executive function, that it is the orchestrator, and it is, but one of its main functions is to receive and process information from the rest of the body. And this is from these neurons that exist in the heart and the gut. And we also know that there's independent neurons that exist in other organs too. It's just that the brain and the gut are some of the highest innervated that we understand to date. We also know that the brain generates specific brain waves specific to body needs and thoughts and emotions. And, this is one of my favorite concepts about the brain and how it works, that, the world around us is an illusion, because basically what the brain is doing is it uses all 5 senses to interpret signals from our environment. So let's say you held an orange in your hand and you went to go smell that orange or feel that orange, all of those sensations are electrical signals that are interpreted by the brain to be that what you recognize as an orange. It isn't actually that. It is actually electrical signals. And it's your brain telling you that this is what it is. It doesn't mean that's what it is. It means that's how it has interpreted it. So if you ask one person how they like the taste of a piece of food, one person might say it's very sweet, or it's very sour, or they smell, the aromas quite a bit more. And of course, some of those have to do with, what people are used to eating and people are used to experiencing. But the other big portion in here is how their brain is deciding to interpret that information. And that's what creates their reality. And it's really important for how we deal with stress. So in this sense, when we look at how we adapt to our environment, we are incredible survivors. This brain and this whole body is wired to respond to the environment in the best way possible to keep us alive. And everyone listening to this today has 100% survival rate to date. As a human being, it's hard to get 100% in pretty much everything. We don't even have 100% saturation level. So when we look at survivors, we're great. And we think, we plan very, very well. And that's what that hamster wheel does and is trying to do. What we don't do so well sometimes, and especially if you struggle with stress and anxiety, is thriving. Now that's where we are in imagination and possibility. Survival is in the sympathetic nervous system. It's about thinking, planning, acting. And thriving is in the parasympathetic nervous system. And it's all about imagination and possibility. Now, imagination is the key here. So this brings us to the subconscious mind. So if we think about the subconscious mind and the conscious mind, the subconscious mind is 95% of our mind. The conscious mind is only about 5%. So if you think about what the subconscious mind does, it basically gives meaning to everything. It's completely objective. If you decide that something is true, your subconscious mind goes, thank you very much. It takes it and it makes it true for you. And then it looks for things in your environment to validate that. So for example, let's say I said, each and every time you see a red car, you're going to think of clowns. And you go, oh, no, I'm not going to think that. And the next time you see a red car, you're going to think, oh, I remember when Sherry said clowns. And then you're going to start noticing how many red cars you see. And you're thinking, oh my gosh, why are there so many red cars? Those cars were always there. When I bring attention to something and I tell you something is true and you decide to accept it or reject it, if you accept it, then you're going to start to see more and more of those red cars. Now think if you did that with what you want, with positivity, with calmness, with success. Think about what life would be like that. Instead, what most of us do is we think about all the things we don't want to happen. Gee, I hope my car works this morning. Gee, I hope my boss isn't going to be a jerk today. Gee, I hope this. So what you're doing is when you take that in, and it's this concept of this has happened before, so the likelihood, well, the subconscious mind goes, well, thank you very much. I'm going to give you some more valid things to see that this is true. So, when you think about how it's built meanings to what things mean in your world, you think about toddlers as well, and 2-year-olds or 3-year-olds that are toddling around saying, what's this, what's that? And you're telling them, oh, that's a table. And they go, why? Because they don't know what it is for. They're learning what's appropriate in our culture, in our situation, in our moment in time. And as they grow up, if someone were to do something outside of what we've told them that is meant for, they would start to look at you as if you're crazy because you've now altered the meaning. So this is difficult for some people when we start to look at change in our world and what they hold to be true and what they hold to for something that should never have a change in meaning. And this is why people don't often do change very well, because the subconscious mind is trying to hold on to an old meaning. It's also the source of triggers. And of course, when you look at that piece with people not wanting to let go of things, or if they've experienced a negative situation with what was formerly just an average everyday thing. So maybe they had a car accident on a Friday. Well, now Fridays may be a trigger for them. Or maybe they had someone at the grocery store got upset with them when they, didn't pack their bags quick enough or whatever. Now they're going to think about packing groceries in more of a negative way. So just thinking about that one task can be a trigger because of prior experience, meaning. So this meaning, and this is why I went into that in such great depth, is that we create the world in which we live. Now, people will do that in one of two ways. They'll do it either literally or inferentially. So people who are inferential, they relate more to their minds. They read between the lines. They're looking for more and more information about everything. Literal people take you at your word, and what you say is what you mean, and they don't go any further than that. So when they look at their world, if you take a literal person just in general, they're going to relate to physicality. They're going to relate to movement and making things and creation or even destruction. People who are inferential, they're thinkers, they're planners, they're spiritual. They are the minds that analyze and pick apart things until there's nothing left to pick apart. So what they're doing is they're creating their world in this particular way, in this sort of structure with this particular meaning, and building a subconscious base of meanings based on either being literal or inferential. Knowing which one you are makes it much easier to understand what it is that you want. So this goes back to where your focus goes, energy flows. So important to understand what your intention is and so that you can place your focus in the place that you want, or the things that you want to achieve or produce. And this directs your central nervous system to activate those areas that are going to support you best. So this is a very good example. I recently gave a talk for a group here in Canada, and there was an older fellow, and he mentioned that he had difficulty with breathing because one part of his diaphragm didn't work right. And so I had been teaching them diaphragmatic breathing. And he said, I can't do that because my diaphragm doesn't work that way. And it's okay, just give me 1 second. Sit back for a moment, give me 3 deep breaths. And I want you to put your focus, imagine that you can feel and focus on that diaphragm, both sides, the side that works and the side that doesn't work. And then I want you to imagine that the breath is starting there, filling up like a cup to the top, and then it's ending there. The last bit of the breath empties at that point. Keep your focus on that point as you breathe. Notice what happens. After a few breaths, this person shouted out, "It's working, it's working." And I thought it was really funny because he surprised himself, because when he put his focus on that place, he is asking his central nervous system to send messages there, to operate in the way that it was capable of to a limited degree, but still capable of. and that he could achieve a breath in a new and different way. So it's amazing what you can do when you understand what it is you want and then put your focus there. Your central nervous system has your back on it. This is also the intention of yogic breathing, or one of the intentions of it, where you're bringing your focus back in. You're using breath to move energy or moving your focus. And it's a whole host of things going on. But the general intention is this mindfulness technique. And, you know, the interesting piece about is that mindfulness and CBT both focus on changing your thoughts. And when you change your thoughts, you change your hormones, and you change your hormones, you change your emotions. I mean, you change those, you create a whole new body response, which again, then it translates into, you know, different, showing up differently in the environment. Now, the response that you have both to your internal environment, how you're feeling inside, and what's happening outside of you really determines how you're experiencing your world. Now, when you can do this in an intentional manner, understanding what it is you want, changing your thoughts, change the hormones, and changing your experience, and you do this in a repetitive way, we are changing pathways in the brain, and that we refer to as neuroplasticity. And now we're changing to the pathways that support us more. So when we look at focus and mindset and all of that, we are looking at different ways and how we can generate the mindset that we want. So we already mentioned many of these: the physical activity, the mindfulness practices, like present moment, which is like, you know, meditations and various different techniques, setting intentions, visualization, breath work, internal dialogue, how you're talking to yourself. Notice how you're talking to yourself. And what environment are you putting yourself in? I mean, the environment is going to determine how you adapt and how you respond. So you become a product of your environment, and we are very adaptable creatures. So understanding when you are creating mindset, when you're in a situation like you're in a hospital that, you know, has all this paperwork and all these things, and you're spending more time with your papers than you are with your patients. Understanding what is within your control. There's some things we can't control, but one of the most important things we can control is ourselves. And we can control choices. We can control what tools and techniques and education that we expose ourselves to and that we carry around with us and use anytime we need to. Understanding our cognitive, our emotional, and our physical needs. And then balance. How are we balancing our lives? Work, family, self-care, all of it. So this leads us to one of the favorite techniques that I'm quite familiar with my hypnotherapy practice. And you see this with cognitive behavioral therapy. There's a couple of different techniques that you can use within relaxation therapy. You can use a body tension reduction. Now, this would be through abdominal breathing or the belly breathing, progressive muscle relaxation, and autogenic training. I won't go into all of those, but you can have a look at them and see exactly how they work. And in general, what they're doing is they're coordinating breath work, focus, and movement of the body and also some visualization in there to physically calm the body. When we look at stress reduction, just in general, we're looking at guided imagery training and meditation. Now, if you move meditation, if you go into meditation with a focus or with a specific intention, and you go a little bit deeper, in general, that would be hypnosis. So, the people who are the inferential, people who understand the world in more of a conceptual way or read between the lines sort of way, they do really well with stress reduction. My high physicals, which are the literal people, they much prefer the techniques such as the body tension reduction. So depending on which suggestibility you are, one method will be better than the other. And sometimes we'll see therapists will use some of these interchangeably, or they will, pair them together. So I often, when I do breath work with people, I add in the visualization and the focus and the intention. It really helps people direct their central nervous system to where we need it most. And of course, if you look at people with PTSD or attention deficit disorder, they need guidance either in person or through media to relax on their own. They need someone walking them through it. Can't just be a tape some of the times, because the tape might not be at the right pace, might not be at the right sort of suggestions that are happening for that client at the time. And they need someone who's right there and watching and noticing how this person is relating to what's being said and how they're relaxing, so that they can change, the tone of the relaxation or the guidance. So this was a really interesting thing that, I kind of had a bit of a light bulb moment with. So many times we talk about people with COPD. I do respiratory education with a lot of people with chronic disease and a lot of COPDers. And what we do is we notice that they have this fast and shallow breathing due to the chest wall and the lung changes. The intention is to manage shortness of breath, right? So when they are, they can't get their breath, they breathe fast and shallow because in general, they're finding it easier. What we do with these people is we'll teach them how to purse lip breathe and slow the breath down and recruit a little bit more airspace, and everything kind of settles. With if you look at someone with anxiety, well, how do they breathe? Fast and shallow to move enough oxygen for short periods. And the intention is survival and short term. Now look at how close these are. These are basically the same thing. When I talk to my people with COPD, one of the biggest comorbid factors of COPD is anxiety. So a lot of the times they don't understand the difference between their anxiety and their COPD dyspnea. So our job is to teach them some techniques that can bring the breath under control before it gets away on them. And in most cases, hopefully, that they can control their breathing before they do any exertion, so that they don't get to that point. And should we take our own advice? Of course, we take our own advice all the time, don't we? Not really, but we probably should. So this leads me to the breath work. So breath work in general, it's structured, it's intentional, and its aim is to basically improve the physical and the mental well-being. It's such an easy concept when you think about it, but it literally affects the physical and the mental well-being at the same time. When I teach people diaphragmatic breathing or belly breathing, 3 deep breaths in and out, and they have shifted from fight flight into rest and digest mode. It's that quick. It's under a minute. You can get somebody to shift their mindset. And when we shift them, this focus with the breath work, we're shifting it into the present moment. And if you're in the present moment, you can't be future oriented, and that one, you can't be anxious. If you couple this with imagination, it can be extremely powerful, like I mentioned earlier with my fellow with a diaphragm issue. So purse lip breathing, we teach this all the time. We highly, highly underestimate it. Basically, what we're accomplishing when we teach people purse lip breathing, it's not just for people with COPD, but when we do teach people with COPD this, we are giving them this tool to use for their anxiety and for their for their COPD. And what we're doing is we're teaching them how to release the old air for new air, because the issue with chronic lung disease isn't that they can't get new air in, it's that they can't get the old air out. So purse lip breathing is allowing us that back pressure to pop the airways open and allow that old dead airspace ventilation to decrease. And what happens is on top of this beautiful effect of increasing the ventilation, the efficacy of ventilation, is we are inflating the lung space at the bottom of the lungs in the way where we are activating the calm part of the nervous system. The parasympathetic nervous system is directly tapped into the bottom part of the lungs. When we are ventilating it properly, we are massaging that part, we are getting that part going. So it's calming the body down with nice, deep, easy breaths. Now, when you are thinking about pursed lip breathing, you can't be thinking about much else. So it gives you something to focus on in this present moment. And if you're doing that, you can't worry. Diaphragmatic breathing, belly breathing, again, this is, I mean, we teach this all the time to our people with chronic lung disease, but it's also the backbone of many breathwork techniques outside of the respiratory realm. The beautiful piece about belly breathing is how it stimulates the vagus nerve and activates that parasympathetic nervous system. So when you belly breathe, you're flattening the diaphragm. When you flatten the diaphragm, you're massaging that vagus nerve. And when you slow that breath down too, we are holding that even more and we're massaging it more. When you stimulate that vagus nerve, we're calming the entire body. When you do this as well, we're increasing the stroke volume, we're increasing the tidal volume, and then this triggers this drop in the fight-flight response. And overall, what we see is an increase in heart rate variability, which we know improves patient outcome. So short term, what we're looking at with slowing breath work down is reducing oxygen consumption, heart rate, and blood pressure. We also see an increase in the amplitude of theta and delta waves. These are the big waves in the brain. And this indicates that we have a predominant calm tone in the body. In this sense, when the parasympathetic tone goes up, the sympathetic tone goes down. And what we're doing is we are balancing out the calm and the fight flight nervous system into this balanced sympathovagal response. Long term, what we're noticing is we're reducing the risk of developing coronary vascular disease and type 2 diabetes mellitus, specifically through improved endothelial function. And we're also improving pulmonary function through residual volume and dead space ventilation and decreased dead space ventilation. So basically, in a recap with COPD and breathwork, the hallmarks of COPD is this hyperinflation causing a flattened diaphragm in not such a great way. We're getting irreversible obstructive flow, gas trapping, and a VQ mismatch. When we add in breathwork that focuses on mindset and the mechanics of it, so the pursed lips and the slower breath rate, what we're doing is we are dropping the gas trapping, optimizing the ventilation matching, and we're stimulating that calming effect. The other thing that we do too is that we add in coordinated breathing. So when people do the toughest part of an exercise, so if you were to do a bicep curl, as you're curling the weight in, you would be exhaling. And what they're doing is they are looking for a less of an exertion on the heart effect. Asthma is another one us as respiratory therapists see quite a bit. It's a hallmark of asthma is that we have a reversible obstructive flow. And then we also have reactive airways that we get triggered both from emotions and from the environment, depending on the person. And that these triggers can be known or unknown, which leads to this anxiety and then this anticipation of, well, when that's going to happen again. If you are able to control that internal environment in that calm, pursed lip breathing way, slowing the breath work down, doing this, a few times a day where you're kicking your nervous system down into this calm state that's more and more of its normal state, then you're now controlling half of what was a former full problem. The thing that we would see with asthma, with breath work for asthma, would be this diaphragmatic breathing, a 4-7-8 technique I'll talk to you in a minute, and then the pranayama breathing in general for the calming effect in the mindset. So this was a beautiful paper that was put out by the Veterans Affairs. It's a whole health tool. It's called The Power of Breath, written by Janice Singles. And so basically, she's got diaphragmatic breathing in there, and she's this manual is meant to teach clinicians to teach veterans self-management, and it's part of their self-management toolbox in general. And just diaphragmatic breathing is what they're using. And then they're also using another one as well too. It's called the bee breathing, or it's a pranayama. Insomnia and breath work. So I teach this one all the time with my clients who are suffering from insomnia. So when we shift our nervous system from a higher state to a lower state, breath work is the quickest way to do that. So if you wake up in the middle of the night and you have difficulty falling asleep, you can use mindset without turning on the lights. You can use breath work without turning on the lights. And we use diaphragmatic breathing to stimulate that vagus nerve and through the diaphragm, the pranayama breathing for that internal, that voluntary control, and then general for the mindset effect from the PNS. So these are just a few of the breathwork techniques that I typically focus on for respiratory therapy in general. We have the box breathing for people with anxiety. That's a typical one. A variation of that one is the 4-7-8 model, which is breathe in for 4, hold for 7, exhale for 8. That one is perfect. It's absolutely perfect for people with COPD because they need that long exhale time compared to the average person. And this is actually based on pranayama or yogic breathing. And I find it really effective for my COPDers. Coordinated breathing, again, that's the exhale with the exertion, pursed lip breathing to slow the breath down, and mindful breathing. So this was, a really interesting study on the psychophysiological correlates of slow breathing. So what they found is that they had links between the parasympathetic activity, so the increased heart rate variability and lung function power, and then the increased brain activity or brain increased alpha, which is we see in meditation, and then decreased EEG or theta power, which would be more of awake thinking, overthinking sort of state. And they're related to emotional control and psychological well-being in subjects. And so they had two hypotheses to consider, what mechanisms might be responsible for these psychophysiological changes. The first one was that we have a voluntary regulation of internal body states. So just the idea that when you slow the breath intentionally down and you notice that calming down with that in the moment, that you have this real quick and effective biofeedback technique. And it's basically feeling in the body in the moment that you are intentionally creating a positive change. The other one was the role of mechanoreceptors in the nasal vault. So this is why pursed lip breathing is so effective. You breathe in through the nose, out through the pursed lips. You're stimulating mechanoreceptors in the nose. And then as you're exhaling with the pursed lips, you're propping open all those dead airspace areas and emptying out all the dead air. And what happens with when you are stimulating the mechanoreceptors in the nose, we know that the brain is washed in these beautiful calming hormones at the same time. So these are the two proposed hypotheses of why we get this emotional control and the psychological well-being as a result of all this happening. So here's the 4-7-8 breathing technique that I typically use with my clients. Again, it's intended to slow the breath rate down. The magic number is 6 breaths a minute. 6 breaths a minute is where most of the studies are typically agreeing is where they see the most calming effect for their clients. So it's a breathe in for 4, hold for 7, and exhale for 8. It doesn't have to be exactly like this. The general idea is that you breathe in and then hold for about double the time, and then exhale for about double the time. And the idea is to get that real nice deep activation or opening up of the bottom part of the lungs and stimulate that nervous system, stimulate the vagus nerve, and calm the mind down. It's shown to positively impact heart rate variability, blood pressure, blood glucose, and endothelial function in healthy young adults. So this was what I'm talking about with the healthy young adults here. This one, a study was done. They looked at the effects of sleep deprivation and the 4-7-8 breathing control. So what they found that that sleep deprivation may disturb heart rate variability, blood pressure, blood glucose, and the endothelial function in healthy young adults, which we kind of would expect. The 4-7-8 breathing control may improve these outcomes in those with and without sleep deprivation. So no matter what, the 4-7-8 breathing control was effective in improving outcomes. We can't sometimes change our blood glucose levels or our blood pressure levels because we have stress or whatever else going on. But when you do the breath work, we can improve those outcomes. So there is something you can control. So mindful breathing, this is another one that I use quite a bit with hypnotherapy. Essentially it's combining several different things. It's the nice, slow, long, deep breaths, using your senses. It brings you into present moment, turning your focus back into the body, noticing the emotions, noticing the thoughts, noticing the body sensations, not trying to see if you need to change anything. I usually ask my clients, see if that thought needs a breath. And I imagine, or they can imagine the breath going right through the middle of that thought, or the breath going right through the middle of that emotion, or the breath going right through the middle of that tense part of the body, and then see what happens. Don't make the body or the thoughts or the emotions do anything. This is just about observing. So we use it in meditation and hypnosis, and it typically brings on a calm state of mind. This is entirely about present moment, and can't be anxious if you're present. Pranayama, yogic breathing. This one was the effects of Brahmari pranayama on health. That's the bee breathing. You can look that up. It's the pranayama in general has many, many, many different types of techniques, but Brahmari was one of the ones, and Veterans Affairs uses this one as well in some of their whole health tools. But pranayama, and this is what I liked on this study, the systematic review, basically that by continuous practice, we reduce the dead space ventilation and we decrease work of breathing just by continuous practice of pranayama. So, and practicing it regularly has a positive impact on cardiovascular and respiratory functions, and it improves the autonomic nervous system towards more of a vagal tone dominance. So triage, notice what you need. Notice what's happening for you. Do you need to have stress management, to have it in short periods where you take a minute several times throughout your day? Or do you want to wait until after the day and then decompress as you go then? What kind of job do you do? Is that even possible? Most people, if you're charting for 2 hours, we know you can close your eyes for 30 seconds or a minute, or even in a minute and a half. I can get most of my clients in a beautiful calm state by 2.5 minutes, simply by putting on a little bit of music, calming state, going into the breath work, moving the attention in, and just breathing. usually what I suggest with people is if they can add in just a few moments throughout their day, here and there. Sometimes you have to set a timer. Sometimes you need to give yourself like a little sticky note with a happy face on it. And every time you see it, you get to stop and just for a moment and take a few breaths, close your eyes and think about something that makes you happy. And that's all it takes to pattern interrupt. We know that people, when they're in a fight flight state and they get hyper focused, if you can break that state just for 30 seconds, you can open up your focus, open it up nice and wide, and you'll notice all the tools that are available to you. You'll notice there is more to life than this problem that you were stuck in a moment before. And this breath that you did for just a minute can pattern interrupt that and change your whole experience of the world. When you change your experience of the world, burnout doesn't become, an option anymore. So triage the situation by checking in with yourself too. How much do you need in the moment? Are you really feeling it? Is your chest feeling tight? Like you're forgetting to breathe because you're concentrating so much? I do it myself, and I teach this stuff because I'm human. So triage it. What do you need? Do you need to stop? Take a break? Do you need to get up and go walk around? What do you need to do? Do you need to do some of the somatic tension exercises? Do you need to do a meditation? Do you need to stop and just go listen to a song on your headset? Can you, pair your charting with listening to music if you need to? Do what works, do what fits into your day to pattern interrupt and keep you out of that fight flight in a continuous basis and bringing in more of that calm state of more of who you are. There we go. So stress management recap. Create a routine based on your preference. So you know what works for you, and maybe try some different things. Keep it fun. We got to mix it up. I mean, variety can be the spice of life, and you can find something that works fantastic for you for a couple of months. When you start to go, okay, I have to do this, that's when you need to switch it up. And remembering breathwork has no limitations. I teach my clients all the time that you can do breathwork anywhere you are, no matter what you're doing. You can do it while you're doing a code if you want to. Literally, nobody has to understand that as you're taking that deep breath in through your nose and long and slow out with your pursed lips, that you're slowing your breath rate down and kicking yourself back into a more focused, present state of mind. And in this state, you are more effective in your workload and you're preventing yourself from going into that burnout phase. The other thing too is release the pressure, right? Talk or dance it out. I always tease my colleagues that, get up in the day and there's stuff going on. I'm like, I think we might need a dance party at my desk at some point today. And we have a good laugh. And every once in a while, I'll bring out the music or something. I can't say I've ever danced it out yet, but I bring out the music and everyone gets a smile on their face. And boundaries, they're the key to work-life balance. Know when your work stops and know how to decompress at the end of the day. Talk to your employer. Do what you need to do to make sure that work stays with work and your home life stays with your home life. And understanding as well too, social support comes in many forms. We are social creatures. We're not meant to live alone. So social support for you can be so many different things. It can be family, it can be friends, it can be colleagues, it can be social media, people that you know on that way. It can be listening to podcasts. It can be reaching out to free networks that manage for anxiety or counseling, free counseling that talks. You can download apps like Calm or all different kinds. So it's all social support, and it's all sometimes, you just need to have several different types available to you so that when you need it, you've got something available. And finally, triage yourself. We do this for our clients in our patients all the time. We see how badly they need help in the moment, and we tell them, you know, this is what we recommend, and we see it, and we see how well they do when they do take our advice sometimes. And I think we can do the same for ourselves, just more often. So in summary, burnout is a progressive response to conditions of a continual stress. It's a result of perception and a lack of tools to manage stress in a workplace that is traditionally, culturally, and economically inclined to produce stressful conditions. We know we can manage this condition effectively early on with cognitive, emotional, and physical recharging activities, like I mentioned earlier. And anxiety is one of the most common feelings in the early stages. And you know, if we leave it unchecked, it moves into a disorder in later stages and becomes a little bit more challenging to address. So understand what's affecting you the most, and start there. See what you need, take your temperature, triage yourself, and maybe look into something new like mindfulness or breath work. Maybe we can take our own advice. These are my references. Thank you very much. I really appreciate you taking your time and being with me today.